There we go. Okay. So I will get going because we've only got an hour and we've got three brilliant speakers plus me. Uh, so we haven't got a loads of time to get through. If you think of questions you would like to ask, hopefully there'll be a little bit of time at the end to maybe ask verbally, but do put any questions or comments you have in the chat, as well as who you are and where you're from, what your job role is, if you have a job. And we will try to answer them as we go along or at the end. Um, so I'll just let these last three, oh, still coming into the waiting room. I think West Midlands might have smashed it and been that we might have the best turnout. Of course, West Midlands uh, got a great turnout. Thanks a lot. Um, so yes, as I say, my name's Ed Davey. I'm the Policy and Public Affairs Manager at Centre for Mental Health. I was myself an elected member for 12 years in the London Borough of Lambeth and was a local government association expert peer. Actually, I still cling on to that. I still mentor a councillor in Sandwell in the West Midlands. I think it's my last one before I have to retire from that role, sadly. Um, and so I've also worked for mental health charities for about 10 years. So hopefully I know something about both local government and mental health. They're my two great passions. So it's a wonderful job that I get to coordinate this activity along with my colleague Bethan, and we love doing these events. So, what is Centre for Mental Health? In case you don't know, for over 30 years we've been the UK's leading mental health research charity, and we support mental health equality through research, policy development, lobbying, and campaigns. And we're commissioned by all kinds of people, including local and regional authorities, the NHS, and others, to evaluate research and co-produce various things, including last year and a bit of the year before, we helped facilitate the West Midlands Combined Authority sponsored Mental Health Commission, and I ended up authoring the entire report because of a change of personnel, which was great. I really enjoyed that, and I got to learn lots more about a bit of your region at least. And if you haven't seen that report, me or Bethan will put the link in the chat. So there might be some interesting things to read and learn from, even if that's not your exact patch. Oops. So we are very keen on local government and its role in mental health, as you can imagine, and that's because a lot of the factors that are protective or risks for mental health, as you can see on this list, are in the remit or influenced strongly by local government. So the protective factors are things like having enough money, being treated fairly, having a positive experience of parenting, having a positive experience of school, having secure, decent housing, having access to healthy natural environments, being able to exercise, eat well, um, be abstinent from smoking and various other substances, and being connected in your community and relationships. And the risk factors are basically the opposite of all those things. I won't read the whole list, otherwise we'll be here all day. But you can see how it's local government rather than the NHS or any other organization that tends to have more of a direct influence on that. And for that reason, we are really interested in learning from and supporting and networking between people in local government. So yeah, councils, they hold the public health function since 2013, including substance misuse and mental illness prevention, well-being, and health visiting, and all these kinds of important things. They're part of integrated care systems, and we're delighted to have Patrick, who's the newly appointed chair of the Integrated Care Board for Birmingham and Solihull, for example, and local government's an important part of those. And they host health and wellbeing boards and Health Watch. They commission and provide adult and children's social care and safeguarding. They're the licensing authority for alcohol and gambling. They're the planning authority for housing, transport, green spaces. They're usually the biggest social landlord. They provide parks, community centres, libraries, advice, and they're usually a very big, if not the biggest employer and economic actor in any area, and they have a role in education. Put it in the chat if I've missed something out, but lots of different things. My 15-year-old daughter drew that little picture. I did pay a London living wage. You'll be glad to know. So what have we got to do with what has Centre for Mental Health got to do with local councils? Well, we started the Local Government Mental Health Challenge over 10 years ago and recruited more than 100 councillor champions who've done all kinds of amazing things. We've produced 2 mentally healthier council manifestos. 2023 and 2022. We'll produce a new one for 2024. And we provide services including to the 5 greater, well, actually now 7 Greater Manchester councils. We coordinate the Thrive London Councillor Mental Health Champions Network. And we've done this work in the West Midlands, I just described, among other areas. And we consistently lobby for councils when we have a voice in national conversations. And now we're doing this new Mentally Healthier Councils Network, which is funded by the Health Foundation. It's free to join the Mentally Healthier Councils Network. It's open to all elected councillors, and making it slightly different from its predecessor, it's also open to council officers. We've got over 200 members so far since June, which is great. And we want to recruit hundreds, if not thousands of people. We want to share information, best practice and networking opportunities. And you are the 4th, I believe, regional launch events we're having. And we'll get around the other regions in time. And we want to learn from you as well. So if you have council policies that you've adopted that you think help mental health in the broadest sense, we want to hear from them so we can feature them in a report to highlight the good work that you all do in your councils. And in year 2, we are thinking of doing an accreditation scheme that will run hopefully alongside the Prevention Concordat. So how can you help? Well, you can promote the network at any events and meetings. You can share information about it in your council communications to colleagues. You can get people to sign up. We'll put the links in the chat. And do let us know if you come across any relevant local government mental health news, and we'll put it in our monthly newsletter. And we can provide a range of useful services. We've just been commissioned by Birmingham and Solihull to do a mental health joint strategic needs assessment, for example. We've also done lots of complex system mapping and co-production and all kinds of other things. So do let us know if we can be of assistance. And like I say, tell us your good practice. This is community wealth building in Preston, which has been found to reduce the need for antidepressant medications, but is about getting people good jobs. So it doesn't necessarily have to be a direct mental health intervention to be a good policy that benefits mental health. And we'd love to hear your ideas for that. So that's what that's all about. So enough from me. They all cheer. Yes, enough from you. We've heard quite enough. Let's go to Lisa, who is the Director for Public Health for the County of Worcestershire. I knew Lisa when we were both working in Sandwell, me as an LGA peer, and Lisa was the Director of Public Health in Sandwell in the West Midlands. And what an amazing job she did. She really put public health on the map and Sandwell on the map, and did some amazing things in what's a very deprived but wonderful area. And we're delighted that Lisa's here to join us and has got about 10 minutes to talk about whatever she likes relevant to the discussion. And we're very delighted to have you. Thank you, Lisa.
Thank you, Ed. Hopefully the sound's okay. Can you hear me okay? Fabulous. Okay, so I promise I'll keep to within my time. I think there's really 3 themes that I'd like to highlight to my local authority colleagues and our stakeholders around how we as local authority professionals, either officers or elected members, can have an impact. But let's start with that potential to have an impact. If you go into any area with a clipboard and stop people and say, who in this area, whether it be Worcestershire, whether it be Telford, who in this area has the biggest effect on people's mental health? People might say, well, the GPs, or maybe the chief exec of the mental health trust. It's not. The 8 or 9 people that have the biggest influence on mental health in any given area is the cabinet or the executive of the local authority. And it's something I always remind our elected members and senior officers in Worcestershire that, as you've talked about, Ed, mental health is driven by education, housing, employment, spatial planning, community development, and of course the provision of social care and other supportive services like welfare advice. So let's be under no illusions, whether we like it or not, as officers and members, every time we go into work and make a decision, we're having an impact on mental health. So let's make it a good impact. There's three things I'd like to quickly touch on, all the S's, coincidentally. Firstly, strategy. Secondly, I want to pick up on one particular element, which is social isolation, and then finally conclude with a word about stigma. On strategy, and I can't take any credit for this, because when I arrived in Worcestershire, what they had already done, my colleagues, is written a health and wellbeing strategy where it had a single primary outcome. There was one outcome overriding everything else, one aspiration, and that's better mental health. And if you go onto the Worcestershire website, I'll post the link in the chat and have a look at our health and wellbeing strategy. You'll see that whatever we do, whatever comes to our health and wellbeing board, whatever I propose as a DPH, whatever anyone proposes, we have to be able to set out, how does this have a positive effect on mental health, and how are we going to mitigate and avoid any negative effects on mental health. All roads strategically in Worcestershire lead to better mental health, and our cabinet member Karen May, colleagues like Tanya and Lucy and many others in my team have pushed forward on that. So I think that's the first thing. Get your strategic ducks in a row, I would say. And let's forget about parity of esteem of mental health. Mental health goes on the top and everything else falls in behind it, I feel, strategically. The second theme, if I could pick out one area of work that I think local government has so much more potential to influence mental health through, it's through avoiding social isolation and maximizing positive social connections. So let's just go back through the evidence. It would be difficult to find a more robust finding in the research literature around health and care as the link between social isolation and loneliness and health outcomes. And I don't mean to blur social isolation and loneliness. They're two different concepts, and the conceptual distinction between them would be enough for a session on its own. But if you just look at social isolation or loneliness separately, both of them have a robust, consistent and significant impact on health outcomes. So we're thinking about everything from mental health. Obviously, people who are isolated have poor mental health, poorer cardiovascular outcomes, poorer outcomes in terms of cognitive impairment and dementia. But also, next time you're in a meeting around the Better Care Fund, remind your colleagues that people who are more isolated have significantly higher risk of a delayed transfers of care, a delayed discharge from hospital. Also remind your colleagues that people are more likely to have an urgent admission in the first place into hospital if they are socially isolated. And equally, they're more likely to end up earlier in long-term residential or nursing care if they are socially isolated. If we can focus our efforts on addressing social isolation, we are onto a big winner, not just in terms of mental health, but pretty much every outcome that is affecting local government at the moment and driving up demand. And in terms of how do we reduce isolation? Well, again, that could be a whole session, but my advice, for what it's worth, would be to always remember the rule of doing your work with residents and not to them. So for us in public health, everything we do in our public health department, we do it with residents. They're part of the team. We don't do our work to them. So we take an asset-based approach. We engage, we use grants. Small grants can be very, very effective and cost-effective in terms of delivering work in the community to reduce isolation, especially in key priority groups. And the third thing I'll end on, and by the way, I've written an article in the MJ about that, so I'm happy to, with a little bit of the research evidence and a little bit of examples of how social isolation can be addressed by local authorities. So I'm happy to, again, put my email address and provide you with the version of that article that has all the research references in. When the MJ published it, they obviously took all those out because it's not that type of publication, but I can send you the original version. So it's a good summary of the evidence in case that's helpful. And finally, I'd end on the third S, which is stigma. Stigma is a pest. Stigma around mental health is a barrier to us achieving everything we talk about on these launch events and everything we'll talk about as a network. And don't let anyone tell you that mental health stigma or stigma around mental health and mental illness has gone away. It hasn't. It absolutely hasn't. And it particularly hasn't gone away in places where you would least expect to find it, among health and care professionals, amongst people who often we would expect better off. You'll find mental health stigma still runs through cultures like the writing in a stick of rock. What do we do about that? Well, we tell stories. One of the best barriers against stigma is tell stories of people who have lived with mental health difficulties and who maybe have, to some extent, overcome them. Facilitate the voices of people with lived experience of mental ill health, either as a person with poor mental health or a carer or family member of someone with poor mental health. Facilitate those voices, make sure they're heard. Nobody gets in our health and well-being board these days without being accompanied by someone with lived experience of the issue we're talking about. For example, this month we're going to be talking about autism, and we'll have someone with lived experience of autism. Facilitate voices in your community, they're there. And also utilize champions. Make sure that if anyone, create a welcoming environment for people who have lived with mental illness and mental poor health to tell their stories, even if they maybe are people that it might be surprising to find out that they've lived with a mental illness. And that's something I've done personally over the years. I've campaigned over the years, told my own story about living with mental health, of being through the mental health system, about how I've still got the scars, quite literally, to show about my battles with mental health. Because the more of us that stand up and tell our story and are facilitated and supported to do that, we start to chip away at the stigma, start to chip away at that wall of stigma that gets in the way of everything else we're trying to do. So Ed, I think that's probably the best I can do in the time available. Obviously, really looking forward to this network and talking more about it with colleagues across the country.
That is fabulous, Lisa, and you're bang on time. I really appreciate that, and such important and interesting subjects. I love lots about that, but I love the idea of, never mind palliative esteem, mental health's the most important thing, because without mental health, it's difficult to have any other sort of health, economic health, physical health, all the rest of it. So absolutely right. Social isolation and loneliness is a huge blight, and linked very closely to mental health, obviously. And then stigma, you're absolutely right. And I was reminded, well, last night, Bethan and I facilitated a workshop for some work we're doing with the local government association. And it was with a group of service users and carers. And it started at 6 in the evening. And after a long day, I have to admit, I was like, oh God, I've got to do this for 2 hours. But it was so energizing, and they were so insightful and brilliant. And it reminded, my first job in mental health was the National Survivor User Network. Funnily enough, sharing a office in Vauxhall with Patrick, but we'll come to that. and it was a service user led organization. I myself was a service user. Lisa, you've inspired me to share my story quickly. You know, I was recovering from depression and problem drinking, and I haven't had a drink since, nearly 15 years now. Feels like an AA meeting now. You're not in an AA meeting, it's fine. And I'd kind of forgotten how energizing it is to be around service users and carers who really can give richness to the conversation and real life experience and make everything much better. So all fantastic messages. Really appreciate that, and you do some amazing work and are a great spokesperson. So appreciate that. Speaking of Patrick, who our paths forever are intertwined, Patrick, from sharing an office in Vauxhall when you were chief exec of the Afia Trust, a black health charity that did some fabulous work. We worked together in Lambeth when you were the first director of Black Thrive, which is a kind of community liaison organization that came out of some work we did on trying to support better mental health outcomes with our black communities. And then I think I'm your number one customer for your 100 Great Black Britons book that came out a few years ago. When I was cabinet member for children and young people, I got the council to buy 100 copies that we distributed to all of our schools for Black History Month. And now here we are, and I'm doing work in the West Midlands, and so are you. So we're fated to be together.
Yeah.
But now you've just been appointed as the permanent chair of NHS Birmingham and Solihull Integrated Care Board. A great platform for you, and a, you know, a very challenging area in every sense. But if anyone can do it, I'm sure it's you, Patrick. So I'd be delighted to hear some words from yourself. Thanks for coming.
Okay, cheers. Thanks, Ed, and the team from Centre for Mental Health, who I've worked with for many years. And it's really great that you're launching this network in the West Midlands for people working in local governments to prioritise the importance of mental health. As you heard from Ed, I've got a long history being involved in mental health. I used to work for Mind also, and I used to work at the Department of Health. And I've sat on various NHS boards around trust providers as well. I'm from Wolverhampton, from the West Midlands, and I'm currently a patron of ACCI, probably one of the long-established black mental health charities in the UK. So, as Ed said, I'm chair of Birmingham and Solihull ICB Integrated Care Board. I'll talk about ICB shortly. And I've been, even though I got confirmed this year, I've been actually interim chair for the last 13 months. And so I've been involved in quite a few things what we're trying to do strategically around the whole stuff around our strategies and particularly around mental health. Also, Andy Street, who's the mayor, invited me to be part of the mental health task force, which was chaired by a colleague of mine, Daniel who is the chair of Coventry Warwickshire ICB. So I think Ed talked about the reports. It's a great report, which I think you'll find very useful. But to add to that, very recently, only just last week, Andy Street just launched a new initiative called the West Midlands Combined Authority Health Equity Council, which has all the chief execs and chairs of all ICBs in the West Midlands with representatives from public health. And we're working with the mayor again around how we cement the important work around health inequalities and obviously mental health in that context. Just to let you know that there's going to be another report coming out quite soon. I'm a commissioner for the Midlands Health and Care Inequalities Policy Commission, and that is working with support of Middle Engine and a number of the universities in the Midlands, and we're covering the East and West Midlands. And that report will again highlight the importance of the role of public sector around tackling health inequalities, and there's a strong component in there again around mental health. So integrated care boards, the latest reincarnation of NHS reform, was established in July 2022, and actually we have a clear remit. Not only our job is to obviously commission healthcare, particularly with the NHS in partnership with our local government colleagues in Birmingham and Solihull, but also we've got a clear remit around tackling health inequalities and also being part of that wider concept of NHS as an anchor institution around economic social development of Birmingham. So we've developed a whole range of strategies and plans over the last 18 months to start this work, basically. I'm just going to just highlight a couple of them for you. Just to let you know, BSOL, the area that we represent, from Birmingham, Solihull, population 1.3 million. So we're quite a big health system. Our budget is about 6 billion, and some of that money is also used to do specialised commissioning, such as dentistry, pharmacy, etc. And the Health Foundation, they did some work about a year ago, maybe a bit longer, where our health system, along with the Black Country, our neighbouring ICB area, as two of the most deprived areas in the country when it comes to health inequalities and deprivation. And so that is already a challenge for us in the first place, to try and transform services, deliver, and particularly for the population that we serve. We're a global majority city, Birmingham, and I'm working with Birmingham City Council and the organisation BRIG. We want to try and make Birmingham to be a anti-racist city, and that's quite important, because race and discrimination is also part of that wider work around health, mental health and wellbeing as well. So we've got a 10-year strategy for our Integrated Care Partnership Board, which has representation of all our key stakeholders. And I actually co-chair the ICP with cabinet lead members for health and wellbeing for Birmingham and Solihull, Marion Khan, who's just on maternity leave from Birmingham City Council, and Councillor Karen Grimshaw, who's deputy leader of Solihull local authority, and we co-chair the ICP. And this is quite important in terms of partnership working with local government. So we, through the work of our board and with support of public health, particularly support of Justin Barney, who's Director of Public Health, and his team, we developed a 10-year strategy, which we launched last year, and with 5 key priorities. And again, mental health is one of our key priorities. We recognise the importance of that. And then to support that, we launched last summer our 5-year forward view, which we're in the process of updating, which is how we're going to implement that work around tackling the 5 key areas, in particular around mental health. We recognise around the whole stuff around transformation of mental health services. It's something that's really important to us. So we launched last April the Mental Health Collaborative. That is a partnership with Birmingham and Solihull Mental Health Foundation Trust, working with Birmingham Children's Foundation Trust, and working in partnership with primary care, working with local governments, and working with the third sector. Because what we've done, we decided that the money that we spend on mental health, which is roughly about £300 million a year, how can we use that money differently in improving service delivery, ensure that the voices and experiences of service users, carers are recognised in that, and how we can transform the way that we deliver mental health services. So and that's the idea of the collaborative. It's about partnership working. We're moving away from a model of competition to one of collaboration and co-production. And this is going to be quite critical if we want to really take forward the work of tackling mental health. And I think the role of local government in this is really important. We have a really good working relationship with both our local authorities around this, and they can see that wider picture as well. We're obviously linked to that is with the whole plethora of documents and strategies to support that. So we've got outcomes framework. Again, mental health is very strong and reflected in that outcomes framework, what we want to see around our indicators of success. But I think the key thing, message I want to share with you on a personal level is that how do we make sure that mental health is not falling off the agenda for local government? That's why this network is important, because from my experiences of working in mental health for many years, in terms of campaigning for mental health, being on boards, commissioning and doing sort of policy work around mental health, how do we make sure that mental health is taken seriously but by everyone, and how we prioritise that? This is really, really important, because mental health has always been the poor relation to physical health, number one. Secondly, we know that people are still not coming forward to share about their experiences around mental health well-being. That's why it's important that politicians, like Ed, I worked with Ed, I used to be a councillor in Hackney for about 8 years. That's why I think elected representatives sharing their lived experiences and engaging is really, really important. And I think the other thing I want to just highlight to you is the whole issue around diversity inclusion. I've worked for a whole range of organisations over the years, and if you look at mental health inequalities, it still means that people from Black and racialised communities are not getting the services that they deserve. They are still traumatised by ongoing issues around racism and discrimination in society, and that's linked to mental health. So the key question we need to ask ourselves is, how can we have an inclusive approach to mental health? How can we work in a way around co-production and collegiately to how we run services, how we develop services? And when it comes to accountability and scrutiny, how do we ensure that we're asking the right questions to ensure that commissioners like ourselves and providers are accountable? I mean, through the ICB, our Integrated Credit Care Board, we have a degree of accountability. The wider Integrated Partnership Board, we have a degree of accountability. Obviously, we have to report upwards to government via NHS England, but also we've launched our community framework strategy last year, because even though we are a bit removed directly from running services, we still have to listen to citizens and get their feedback to ensure that whatever services that we are commissioning or working in collaboration with our NHS partners and with local governments, it meets the needs of communities. This is really, really important. The role of government is really important. And I'm hoping that despite lots of promises for more resources, we still need more resources to support the work around mental health delivery. But also we need to make sure that we give more centre stage recognition of the voices of those in those communities, lived experiences, carers and others, and campaigners and clinicians, to ensure that we are delivering services fit for the 22nd century. I'll stop there.
Thank you, Patrick. Some great points and some really interesting questions for us to think about, and really appreciate your thoughtful contribution. That's really helpful, and looking forward to working with you in this really important role that you have in the region. So that's really helpful. And then last but not least, and appropriately, we're giving the last word to an elected member. Heard from an officer, we've heard from a partner, which is what we always want to do, but we also want to hear from elected members as well. And Councillor Kelly Middleton from Telford and the Wreckin, is cabinet member for many things. I won't mention all of them because we'll be here all day just mentioning what's in your portfolio, Councillor Middleton. But most relevantly, public and mental health is in Councillor Middleton's portfolio. And I will hand over to you to give us a councillor's perspective, having heard from officers and a partner agency. Thanks a lot.
Thank you so much. It's been really interesting to hear, actually. And for the first time in Telford and Wreckin, mental health has been separated, and there's a title in its own right as a cabinet role, which I'm really proud of, and reflects the importance to us of mental health. So I've worked in mental health for 15 years and in the third sector, and I currently work in homelessness as a health and wellbeing specialist, working with homeless people with mental health and addictions. And I've been Centre for Mental Health champion for a few years now, and the work that I do is really fantastic. It's been really good to see, and great to see the development into the mentally healthier council network. So well done for that. I think there's lots we can do as councils and councillors to promote good mental health and support mental ill health. And I think the first and most important thing is to talk about it, and always create a platform for others to do the same. Anyone who knows me knows I can turn any agenda item into a conversation about mental health. It really is quite a passion of mine. So, and it's something that I raise as often as possible. And as it's been said, housing, travel, infrastructure, the economy, the environment, everything that we do as council, as councillors, is impacts on mental health, and likewise, alternatively. So some of the things we've done around mental health in our community. So I went out and I became the mental health champion. I went to all our 10 and parish council meetings, which took a while, and asked them to elect a mental health champion or representative in all their parishes, which they did, and everybody was quite keen to do. And we now have 28 mental health champions there who I meet up with, and they promote services in their wards, champion mental health, raise awareness, raise it on agendas where needed and appropriate, and ensure that information is put out in their newsletters so that we can meet up and plan work. I've also written a mental health training session, which Andy Bell was happy to put your Centre for Mental Health logos on. And so I've been out into community settings, and that's to support with practical advice on what to do if somebody comes into community settings and how to support them. And I've trained staff in community centres who said they found it really useful, and I'm also training our counsellors soon. And that way then we can share information and they know who to signpost to and who to contact with numbers and things. It's been really helpful. So that training, just that practical advice on, you know, if somebody comes into your space, what can or can't you do, and what should or shouldn't you do, it's been quite helpful. Around young people, we gave GCSE and A-level students a month's free and half price for a month leisure passes after their exams as a de-stress, which was really taken up well, and a lot of young people used it after they finished their exams, and it's good for that physical exercise as well for them, but it enabled them to go and relax and de-stress and use the gym, so that was really helpful. And we've done a year of wellbeing with our residents. We did a campaign and they signed up and they got 5 ways to wellbeing we used, and they got all emails and information sent to them on ways to stay well with tips and advice. And then they got to make a pledge around their health and things they wanted to do to stay well. I gave a pledge to quit smoking, which I have done for the last 2 years now, so that was helpful for me. And we had a fantastic response, and 98% of them said they would recommend that campaign to their friends and felt better as a result of being on it. So it was really, really positive campaign, and it gave us a really good platform to talk about mental health and talk about well-being and share things across our networks, which was really good. And now we've launched this for the year of young people as well, the year of wellbeing, and had a youth mental health summit, which was a huge success, which was led by the Youth Parliament and the Youth Forum. So we worked with them, with our public health teams, and we set up the Youth Summit, Mental Health Summit, and a lot of schools came and we worked with young people, and we did a lot of interactive sessions around their mental health and things that they found helpful. So there's some work coming off the back of that, which has been really good. And we've also funded a Make a Change project. And we fund groups that are led by young people to support positive mental health using our services within our communities. So we fund those projects and those children and then support them with those things, and then we can promote them and talk about mental health with young people. So that's been really positive. And we set up a mental health alliance, which I'm on, which is really good, where the third sector, mental health social workers, mental health trust, police, drug services, housing organisations, various people meet weekly to case conference people with mental ill health in our communities as professionals that need more wraparound support, and that's to prevent 136s, to ensure people get the right support in our communities, and it's chaired by our mental health commissioner. So that's been going really well. That's been going since COVID, and it's been working really well. Originally it was 2 or 3 times a week, and now we just meet weekly, because since COVID's over and everybody's back to normal business, so we do it weekly now. And we've set up a mental health partnership that feeds into our mental health strategy, health and wellbeing strategy, and we do workshops with residents to get their feedback, which I chair as cabinet member for that. And we've also got a fantastic mental health forum, which professionals then can share good practice and things they do together, and what services they run. So I found that outreach mental health services, one of which I'm not promoting my own, but I run one, is mental health outreach has a great impact on our outcomes, and getting out to people really increases engagement and builds positive relationships. You know, that we need to tackle complex mental health and often dual diagnoses. So this approach works really well in the voluntary and community sector. And that has been said is with that lived experience and working with people to understand what's most helpful. So that's been a really positive change, where we've done a lot more of going out where people are and not asking them to come to us. With a bit of a no closure model, which has been really helpful, so we can keep people actively working and tackling where the right places are for them. And there are other things we've been doing, but I'm mindful of time. So it gives you an idea of things we've been doing and how local authorities can have positive impacts on mental health in our communities. So I think that's me. I could talk about mental health all day, but I won't, because I know we've got short time. So
That's brilliant. That's so good. Thank you so much for that. I mentioned we want to write a document, 100 mentally healthier councils policies. It sounds like we could do one just for Telford and the Wreckin. Sounds like you got 100 just right there. Never mind the rest of the country.
well, I'm
Um,
happy with that. Yeah.
I particularly like the stress busting reduced swim and gym for student. Not I've got a 15-year-old doing her GCSE mocks right now, and she's been talking to me about getting a gym membership. Whether when I pay for it, she'd actually ever use it, it's a different matter. But anyway, it's a nice idea. We should encourage the good idea, especially now everyone who got gym memberships as their New Year's resolution has cleared the gym because it's now February. Have you noticed that? If you use the gym, they've all gone now, haven't they? It's got quiet again. Anyway, we shouldn't judge. It's good that they went at all. Yeah. So really great stuff. Thank you so much. And you know what's always great about talking to counsellors is, you know, they're not professionals in the job of being a counsellor. Nearly all counsellors do other jobs that they bring that expertise to the role. I mean, in your case, it's very relevant, and it was relevant in my case, but sometimes you get some really interesting combinations of different expertise brought in. And that's what, you know, on a good day, politicians bring that. They are not officers. They're meant to bring a different perspective and represent their communities. And clearly you're doing a great job at that, Councillor Middleton. So thanks very much for that. So we've got some time because everyone was very disciplined. Unlike the Northeast, don't tell them. We only had 2 speakers and they used up the whole time. I didn't have any time for questions. But you guys, much more disciplined. They were very interesting in the Northeast. They just used a lot of time. But you guys were very disciplined and pretty much stuck to your time. So if you do have any questions, post them in the chat, or you can put your hand up. And otherwise I will Phil. Yeah, typical Geordies. Yeah, that's right. I've got a few questions, but Caroline Kyoto, if I'm pronouncing that anywhere near correctly, was interested, Patrick, by your mention of trauma. I think it was in relation to kind of the trauma of racialized communities experiencing racism. And me and you have had many, many conversations about this because it's a scandal that people racialized as black in this country have much, much worse mental health outcomes than white British people. And there's no biological reason for this. It doesn't happen in black majority countries. It's very much the result of trauma experienced as a result of systematic racism. And we and Patrick and me and others have thought a lot about this, but the question was about how do we sort of embed and ensure trauma-informed approaches in services. I mean, you were talking about racialized trauma through racism, but there's also kind of gendered trauma, you know, women experiencing domestic violence and other abuse. I remember Geraldine Strathy, who was a fantastic psychiatrist, saying to me at least half of her patients had experienced some major trauma as children, and the literature bears that out, you know, that traumatized people often then develop mental health conditions as a result of it. So what do we do to A, prevent trauma, and B, to ensure that our services are sympathetic and are able to respond appropriately to people who have experienced it?
Yeah, I mean, that was just one example, Ed. I mean, I think the whole stuff around trauma inform is something that we should embed for everyone, because people have different types of traumas. You know, one of the things that we've done as a system at the ICB, but also Birmingham Children's Trust, which run Children's Services Birmingham, and Solihull Local Authority, we've recognised that the care leaver experiences as a protected characteristic, because again, going back to, you know, all the research work's done, children who are looked after, they have the worst health outcomes in terms of education outcomes, life expectancies, and opportunities. So, and we believe that is as a distinctive group of vulnerable young people, they are traumatized all the time, or they have different experiences of trauma. So that's why we as a system have recognised that. We've actually, with one of our trust providers, we've developed an apprenticeship scheme, which is a national scheme that's been developed by NHS England, but to give career opportunities for care leavers through an apprenticeship program. So this is just one simple example how you can counteract. It's not about running a service, but it's giving someone hope and a job. And there's lots of initiatives where doing stuff around housing and education. But I think the point is we've got to think differently about how we run and commission health services, particularly around mental health, and recognising the impact of trauma. I mean, I've been involved in the whole stuff around the Windrush scandal. There are thousands of people traumatized because of the hostile environment policy. We've heard about what's happened recently around the post office and Horizon IT. Again, those people that ran post office are all completely traumatized because they were made to feel like criminals. So this experience of traumatization is actually becoming more universal. Even during lockdown, during COVID, everyone got traumatized. Everyone experienced social isolation. Everyone had some degrees of depression and anxiety, and we haven't come out of that completely. So I think it's how we build that into our thinking, not just around one or two distinct communities with particular protected characteristics, but how we build that in as a way of being as well.
Yeah, absolutely. At its heart, it's about being empathetic, imagining what it must be like to imagining whoever's in front of us is our brother or sister, or if it was us, how would we want to be treated? And all the evidence shows, and it's common sense, that if we can be empathetic, then we will respond more appropriately to people's situations. We can't always understand it because we've got different experiences, but that is a good place to start. And yeah, Lisa, have you got anything to add on the trauma question and how we ensure our services respond appropriately?
Yes, and I think the concept of trauma is absolutely central to what we're talking about here. Sources of trauma and identifying them is key, I think, especially to not just to the service side of things. I really like what Patrick said about making sure trauma-informed services is something that we embed. It shouldn't be a side salad, nice to do. It should be embedded within the core of delivery. But also from a more population public health point of view, what are some of the key sources of trauma that we deal with and that we encounter in our residents, in our service users, if we're running a service every day? Take bullying at school, for example. As we sit here now, there are thousands of children in school at the wrong end of bullying. And the research suggests that the impact of that trauma of bullying at school continues to affect people right through their whole lives. It affects their education, their relationships, their ability to hold down a job, their ability to function and fulfill their potential. So I think it's about seeking out what are the key sources of trauma in the lives of our local population, and how can we work with our partners across the system to mitigate and address them. So we, for example, in Sandwell are doing in Sandwell, God, did you hear that? I'm back in Sandwell. I can see Joe looks more brown laughing at that. I'm in Worcestershire now. Please don't show this to my boss. In Worcestershire, we're giving grants to schools to enable them to pull together their own ideas and deliver their own programs on how to address things like bullying, mental health, social isolation, etc. Let's empower schools and the partners and system around them to address the trauma of bullying. Is just one way in which we can start to minimize, at least, never get rid of, but minimize the effect of trauma on people's lives.
Oh, I lost my mute button there for a minute. Oh, excellent points. Thank you, Lisa. And Council Middleton, I guess you can draw on your work with like homeless people and in mental health as well as your portfolio. Talk about a little bit about trauma, please.
Yeah, no problem. We have done trauma-informed training across all our services actually, because we do recognise the importance of that sort of way of working. But we work with homeless people, and when you speak to our drug services, over 70% have had trauma who use our services for substance use. And the main cause of homelessness, certainly here, but I'm assuming generally, is relationship breakdowns as a result of mental ill health or substance use, which is all leads from trauma. So it has a huge impact, every day on how people's lives, like you say, their ability to sustain relationships, accommodations, relationships. It's all impacted by trauma. So absolutely agree that trauma informed approach is vital, and everybody we work with assuming they've had some trauma, and that the ways in which that they're sort of living are as an impact of that is a much easier way of working with people, which is the approach I take when I'm at work in my day job. But it's certainly when you're looking for services that are going to work in that trauma-informed way as councils as well. So yeah.
Thanks very much. No, we forgive you, Lisa. You'll always a part of you will always be in Sandwell and vice versa. It's okay.
I'm not sure my Worcestershire colleagues are going to forgive me.
Yeah, oh, it's fine. It's fine. You bring your Sandwell experience to your Worcestershire. It's fine. Don't worry about it. So I'm going to squeeze in one last question of my own. Indulge me as chair, which is a sort of the elephant in the room, which is, obviously we're not a party political organization and that's not the idea of it, but we can't ignore the fact that local government has been under immense financial strain over the last 10 years or so. Birmingham City Council, some of that isn't just austerity, it's the equal pay award and things like that. But we've got 8 or 9 councils now that have issued Section 114 notices, so it's essentially being bankrupt. So you've talked about lots of really constructive things that you can continue to do in local government, but how do we kind of collectively support local government to make the best of what opportunities it has and to maximize its ability to work for people's mental health, even in these like very difficult financial times that local government faces? I'll give, who am I going to give first? Let's go back to Patrick for this, seeing as you're slightly out of that world, but you work with it and you've got experience in it too.
Well, no, we're in this world because obviously we work very closely with Birmingham City Council. As you know, they got Section 144 notice, so they've got big challenges. They've got to save about £300 million in 2 years. So we've been having regular dialogue in terms of the officers with their officers, and also I've had meetings with the leader of the council, the cabinet members for health well-being. We've actually got a meeting next week with the lead commissioner who's got responsibility for Birmingham, just to kind of articulate the impact, particularly working with the NHS. We invest a lot of money working in partnership with local governments. We spend about £100 million a year. That's through our hospitals, through our community services, joint commissioning arrangements. Most of that stuff is actually statutory, so it's kind of protected, which is good. But I suppose the impact is, again, Birmingham and Solihull is one of the most deprived areas in the country. When you talk about core 20 plus, it's actually core 80, because 80% of the population of Birmingham meets that criteria. So it's going to be a big challenge for families, for people, vulnerable adults, and obviously, we hope that we can work with the commissioners and the local authority to minimise the impact of the cuts, but they'll have it may have an impact on our vision around tackling health inequalities and through our strategies as well. But let's see what happens, and we're hoping to have a kind of a positive outcome working with, working as well. It ironically it provides opportunities, because it means that we can look at things differently. how we commission, how we do more joint commission of services, and working differently as well.
Excellent. Well, I hardly got any more time, but Lisa, do you want a quick word on that one?
Yeah, I think Patrick summed it up when he used the word partnership. We've never been able to afford to work in silos, but now less than ever. Yeah, I think it's what our elected members expect of us, and it's what our residents expect of us. We've got system-wide problems that require system-wide solutions. So we cannot have public health here, adult social care here, children's and NHS over there. We have to get around the table and come up with those system-wide solutions to system-wide problems. We can't afford to do it any other way. And until we genuinely, in this era of integrated care, until we become genuinely integrated across systems and become more than the sum of the parts, we're always going to struggle to keep progressing in the context of dwindling resources. So it's all about joining forces and working as one team.
I'm afraid I'm going to have to leave it at that, because one of my only jobs as chair is to get you all out into your next meeting or go and have some lunch or something at 2 o'clock. So sorry about that, Councillor Middleton. Thank you so much for all our brilliant speakers. Thank you, everybody, for coming along. Really good turnout. The best in the country. Well done, West Midlands. You smashed it. Really, really great conversation. I've really enjoyed it. Please do sell the network to all of your partners. Put the links in the chats and from the emails into your council network emails, so that you can get all your colleagues to join, officers and members. And we really look forward to working with you further and being inspired by you. And yes, Patrick, I'll be in touch about our work on the Birmingham and Solihull mental health joint strategic needs assessment, and we will draw from Worcestershire's vision of just caring about mental health and nothing else matters at all. I love that, and all the wonderful things you're doing in Telford and Wreckin. So thanks so much, and thanks to my colleagues, Bethan, for supporting this meeting. Really appreciate. Do get in touch with us if you've got anything else to add, and have a wonderful rest of your afternoon. Thanks a lot, everybody.